Hello, Northeast Pennsylvania. This is Charles Stevens, Doctor of Physical Therapy and founder of Mobile Therapy Services here at our clinic at 27 Main Street in Dallas. We have a very cool and unique modality here to show everybody. This is our portable diagnostic musculoskeletal ultrasound, and we've been getting a lot of questions. What is diagnostic musculoskeletal ultrasound? Unlike therapeutic ultrasound, which also uses sound waves, and the goal of that treatment really is to promote healing and to heal tendons and muscles and soft tissues. Diagnostic musculoskeletal ultrasound is a diagnostic tool that gives us a window into the body. Diagnostic musculoskeletal ultrasound has been called the stethoscope of the 21st century. It allows us to view things we otherwise would not be able to normally see. So the cool thing about it, unlike an MRI in which the patient would have to lay completely still, would not be able to move, with a diagnostic musculoskeletal ultrasound, the patient could move, which is beneficial because we can see tendons moving over bones, nerves gliding, which will allow a very unique image and to be able for us to visualize varying pathology. It can be utilized from conditions ranging from shoulder impingement, where we can see the shoulder in active range of motion, where the ball is moving within the socket, and we can see, is the bursa getting pinched with active range of motion, or the rotator cuff getting impinged upon, to the TMJ, when having the patient open and close their mouth, and we can see, how is the joint moving? Is the disc dislocating during motion? So what's occurring with the kinesthetics there? So it's a really, really neat modality. So I was going to demo it here for everybody. So we get our ultrasound gel. We have our cool little iPad. It mates right up with the iPad. And we're going to come right over. If anybody's ever heard of tennis elbow, we're going to come right over to the common wrist extensor tendon, which has an attachment on the lateral epicondyle here. So we're going to come over, and I'm going to try to get this in frame here. And actually, I'm right on it. We can see the joint line there. We can see those two darker structures are the bone, and that fibrillar structure at the very top of the screen. I know this is tough to see via my iPhone, but if I move, we can see the tendon gliding, and I can get an image of the tendon at its origination and track it down as it's running down into the forearm, and we can get varying views to localize that tendon and to look at the integrity of it. And you can see on the screen with my motion, the picture is changing, which is looking at the tendon, and the tendon's gliding over the origination and over the bones on the lateral epicondyle. So very cool. If you're interested, and if you have some conditions that may benefit from this, you'd like to visualize some of the anatomy and see kind of what's going on, from knee, from meniscal tears to arthritis to shoulder injuries, foot and ankle, elbow, wrist and hand, carpal tunnel, the median nerve entrapment within the carpal tunnel. We're able to visualize all of that and get really great views of the anatomy, and you can custom tailor your rehabilitation protocol to what's going on within the body. As mentioned, we're the only provider here in Northeast Pennsylvania within private practice to have this modality, and it's a great tool that will help us design a rehabilitation protocol to get you back to normal naturally without unnecessary injections, medications, and surgery.